Democrats sounding the alarm bells, claiming that people will in fact die under the new Republican health care plan. But is that really true?
Well, let's separate fact from fiction with radiologist Dr. Nicole Saphier. She joins us right now.
Good morning, guys.
Good morning.
Good to have you. So let's help break this up. I will tee you up with the myths. So number one, the AHCA does not cover pre-existing conditions.
But that's just not true.
Okay.
And in fact, it will remain federal law. We will be still covering pre-existing conditions. Now, states can apply for waivers, which means that they're going to be giving their people choices in the different type of coverage options. And in that case, you may see coverage options changing. But in most of the amendments, they're actually providing pools for the high-risk coverage.
That was part of the final negotiation
Right.
as well. Okay, so the second myth that's all over the place about repeal and replace of Obamacare is that it'll make health care unaffordable for those with pre-existing conditions.
Well, health care is currently unaffordable for everyone, so let's not forget that, okay?
Great point.
Right. Now, what is insurance? Insurance is protection against something that may happen. You know, we have car insurance in case we get into an accident. If you get into an accident, what happens to your premium? It goes up. For some reason, people accept that. When it comes to health care, people take it a little bit more personal. And the way our health care system works, health insurance doesn't function as insurance right now, and we just all have to move forward and accept that. When it comes to health insurance, if you are in a state that has a waiver, you may see more. You may have to pay more for pre-existing conditions, but that's why these funds are going to be in place, these high-risk pools to help offset those costs.
But that's also a decision the state legislature is making, not
right. We're taking the control out of Washington, putting it back in individuals and the state's hands.
You sort of answered our myth number 3 already, but we'll dive into it anyway. Under this AHCA, states do not have to cover essential health benefits. Is that myth, reality?
Absolutely untrue. Federal law remains. Essential health benefits have to be covered unless you're in a waiver state. And if you're in a waiver state, that is when you're actually going to see you're going to have more coverage options. That's what people have been demanding. They're saying, I don't need maternity care. Why am I paying this? Why am I shouldering other people's expenses? These states are actually going to give tailored health plans for individuals, and you're actually going to be paying for what you need. And
like
therefore, you see lower premiums.
It's like your cable bill. Why am I paying for lifetime?
Right.
You know why you're paying for
Right, that's true.
That's all he watches. Let's be real. All right,
Dr. Nicole Saphier, if Republicans are smart, they will play your interview on a loop. I mean, you just got to break down the myths, and you did it for us.
You know, the bill is not perfect. It has to go through revisions, but I think they're going to get there.
Well, we needed you here this morning to break it down. Thank you, Doctor.
Thank you.